right. He says, though we've already started the conversation with Dr. here. Dr. Ignatius Kibe, as earlier mentioned, a gynecologist, is with us this morning. And we all understand how heated last week was. We all picked points that were really, really helpful for us. And I mean, even as we picked points on that particular subject, others, cropped up, and a couple of people have tried to reach out to Dr. As we get to address more on reproductive health. And so today we keenly speak to the ladies, but again, of course, to the men, because when we're talking about infections, most of the times you realize that also the men could get you having infections in a way. But Dr. says, it's quite not clear as to what really infections are, and what triggers the same, what would you classify as an infection and what not, and all these things. And therefore, in my own capacity, I might not be able to bring it out as it should be, but I'm glad that we have Dr. so that he would make us understand, probably speak to the ladies out there on how we need to be careful so that at least we are in the best of shape, but importantly, what we need to classify as infections and how fast we need to go and seek medical attention. So Dr. it's good to have you, even as we continue on this subject of reproductive health.
Thank you very much, Linda.
Yes, last week we spoke to the men. I had a good time.
Very good.
Really a good one. I picked lessons last week. It was heated. I don't know whether you ever get a chance to look at some of the feedback online. I know, but it was intense. It was huge. There were lots of fears. There were lots of disagreements in regards to the key things that we raised, but bottom line is that we all picked lessons. That was in regards to fertility in men last week. Today, as we expound more on reproductive health, we'll speak to the women.
Yes, and men.
And men too. I agree.
Because many times, Linda, it is the men who transmit.
Yes.
More times than not. And women, I would like to see women as recipients. Mm-hmm. And there is a giver. And for a man to be the transmitter, to be the agent, like a mosquito is a transmitter of malaria. So the man is quite often a transmitter. But for a mosquito to transmit malaria, it must have bitten a person who has malaria. Mm-hmm. So what will have happened is that there was a woman who had the infection. The infection
that this man got it from.
Then he gave it to another woman.
Okay.
So what I have realized, Linda, and why probably this may be necessary, is nearly every other girl who goes to hospital these days, they want to tell us, I have an infection. When you ask them what infection, they don't seem to differentiate between a sexually transmitted infection, a urinary tract infection, a natural discharge, normal, so-called normal discharge, and the abnormal discharge, and where the boundaries are.
Right.
I don't know what to call it. I would like to say sorting out vaginal infections, because they are caused by various and different microorganisms, pathogens we call them. It's just like when somebody says he's a farmer. Then you have to break it down. On his farm, there are chicken. On his farm, there are cattle. On his farm, there are donkeys. On his farm, probably on the other side, there is coffee. Probably there is sugarcane. So what is this? What is the girls, please, when you say I have an infection, what are you talking about? And I would like them to also understand that there is a possibility of conversion of a urinary tract infection to a sexually transmitted infection. Okay. A UTI to an STI.
Okay.
And even the opposite. That is, somebody could be having an infection in the genitourinary that transmits from the place where the man procreates or enjoys with a woman back to the urinary system, and from the urinary system down to the reproductive system, because they are two different systems, completely different. And I would like us to go back to primary school science, where we were taught digestive system, excretory system, reproductive system, blood and circulation system, the nervous system, the central nervous system, things like that. So initially, I would like to tell girls, in particular, and men also, in general, that there are different causative pathogens. Pathogen means any microorganism, seen or unseen, that can produce disease. Because there are some that are there and they are not producing disease. We were taught again in primary school, harmful and harmless and useful bacteria. So let us talk about probably an infection in the urinary tract. When we look at an infection in the urinary tract, it could be from hygiene itself. I said again and again, not a woman, not a single woman, nobody should go to bed before wiping themselves clean, nicely. Because that way you'll be able to wipe off any bacteria that are lying around. You'll be able to wipe off any fungi, and quite often even viruses. So you should make sure that before you retire to bed, you wipe off nicely with a wet cloth, preferably warm.
Now that you speak about that, the cleaning system, I am told that the system cleans itself. But sometimes we get a little bit deep and intense and very radical on how we're cleaning ourselves. One would say, okay, well, there's one who would say, well, the system cleans itself, so there's no point of me wiping off. Another would say, well, if it's in the process of wiping off, we go deep, we make sure that it's extremely clean.
No. We differ with girls. Some girls think they'll pick even a sponge, a rough sponge, and make sure that she's so very clean that that the husband will enjoy. In the contrary, you see, the lining of the reproductive system and even the urinary system, the lining is very soft, it is gentle. We have cells that we call epithelial cells, that if you wipe off, if you scrape them off, then you expose the private parts or the urinary system to bacteria. And there is something I keep stressing, and that is the pH. So whereas the system will clean itself, that means that there is fluid, and we say there is no more fluid that will probably have been secreted by the cervix or by the V cells themselves. And this fluid, of course, has an outlet, a way out. It's like sweeping a house, but there is you sweep from the gate towards inside, and you again have to collect the sweepings. You see, you can't leave the dirt at the side of the gate. Yeah, I've seen women who clean or who sweep their rooms, and behind the door
they place the dirt.
They place the dirt there. That's why behind the door, that is just externally, we call it external genitalia, there should be a clean wipe. And this wipe should always be away from the main organ, which is reproductive. The other thing I want to mention at this very early stage is, please avoid disinfectants. You know, there is a lot of advertisement from manufacturers. When you want to go there, you clean it with this disinfectant. This is the best disinfectant. They even show children playing in the field, and when they hurt on the knee or somewhere, they use the same disinfectant to disinfect it there. I say no.
Then use what?
Water and plain soap. Water and plain soap. I have seen ladies, and I don't blame them, they want it to be so very clean, so they have been told lemon.
And toothpaste.
And toothpaste. And a certain brand of a cold, what do you call them, beverage. they are pouring that beverage.
Yes.
And sometimes mixing it with toothpaste. And
and sometimes it works. By the time you're being told that, is because maybe it has worked.
No, it is because it is a temporary, very temporary disinfection.
Okay.
But it will cause more harm than good in the long term, because you'll now make the place have an acid or a basic environment. And there are certain bacteria that like it when it is acid. There is a certain bacteria that like it when it is basic.
Okay.
So please, water and soap. The same soap. These days there is a lot of commercialization. You find people being told this is a V cleaner, this is a V lotion, this is, and some women are going to the extent of even buying advertised products that will make them virgos again, virgin. No. Once you break those places, don't ever imagine that you can.
You can never be.
Some women have been told that if you use this lotion or this cream or this or the other, that it will become tighter. Tighter what?
It cannot.
I mean, how do you? It's like somebody telling you your mouth will become smaller. It's like it's a bit silly. People are making money and spoiling our women.
What about the exercises like Kegel?
Kegel is all right, good enough.
It makes it what?
It makes the whole place tighter if you want,
so
but not
possible.
Smaller.
Okay.
You see, I have very many even telephone calls, on the other hand, from boys who want their organs, their dicks, oh God, to be longer.
Okay.
No, you cannot make your ears,
okay, your ears
longer or shorter. If you are born with guinea ears, then accept them. If your nose is blunt like mine and is shorter and thicker, and it's not like the hook of a white man, please accept it. Don't be told that there is a possibility of going to the private part of a man and pulling it. Some people even say you hang a stone and you walk around with it.
Are you sure, Dr. these things don't work?
No, you see, first of all, what are you after?
Okay.
It doesn't mean that the longer the arrow, the more straight it is. And even if, like hanging, that's artificial. That is it will go back. You see, you are wasting time and money. When you tell me that your V will become narrower or will become tighter. Exercises, yes, but know that it is not a permanent solution, and most of it is commercial. Let's go back to washing, because that is where the crux of the matter is. Girls coming to us and telling us, I have this persistent UTI. Don't call it persistent UTI. It could as well have converted long time ago to a sexually transmitted infection. It is UTI, urinary tract infection, but the urinary tract, the system of urination starts from the kidney down the ureters, down into the urinary bladder and out through the urethra to the outside. And it is completely different as a system from the other one, which is reproductive. But they are neighbors, they are next door neighbors. So whatever is in the urinary tract can easily trickle down, the bacteria can trickle down to the reproductive system. But somebody even putting lemon, somebody putting their avocado, they are told the more avocado you stack in and they pump inside, the softer it will become, and the more slippery it will become, and I will not have dry sex. Oh my, no. You're spoiling the whole place.
And so this is something that will make a woman prone to infections?
Absolutely, not just infections.
Before we even get to that, now that you mentioned, dry intercourse or something of the sort, how bad is that? Or why should it be a big deal? And how can we address that?
The man is very, very uncomfortable.
Okay.
The woman is very uncomfortable. And many ladies who have dry SXY, many of them will not just not enjoy, but will be bruised. Number one. Number two, they will not reach orgasm easily. So in the wisdom of the Creator, He placed two glands inside. They are not visible. They are in the muscles. And I mentioned them last time. They are called Bartholin's glands. Bartholin's glands. And these glands, the more foreplay you do, the more they come on.
Okay.
It's just like, and we give this example to make people understand. If you are missing something, if you are missing fruits, for example, and you see a ripe, yellow, good orange, or a good lemon, or a good mango, you salivate.
Okay.
Why? You salivate because you have glands, the salivary glands, underneath the mandibles. So what are we talking about? If you stayed for some time and you are missing your man for a long time, and he caresses you and he plays around with your, there are several points, like the mammary glands, the breasts, like the mouth kissing, like touching various places with high concentrations of nerves, like touching the inside of the thighs, like stroking the back, like stroking wherever there are many concentrated. Even this clavicle that you see here is very good. If you played around with all these places, and even when you play,
the tips, man.
The tips. Even when this man plays with the C at the top there, and he gets a gentle way of playing with it, it has more than 4,000 nerve endings. We call them dendrites. And it will make the lady wake up.
Okay.
And will make the lady desire. And once she reaches that stage, the Bartholin's glands, just like the glands of the saliva will throw some fluid, which will lubricate the inside. Now, woe unto the woman who was dirty or who had an infection, untreated infections discharge. And this woman who had untreated infection, the shimo, the holes, the ducts that will
are blocked.
They are blocked.
Before you go to that level, maybe they are blocked, or maybe you never had infections, or maybe, well, the man is not well conversant with the tips.
With the tips of...
what are the dangers of using lubricants? What are the dangers of using saliva? Or is it okay?
No, it isn't. Saliva itself has a pH and has bacteria. By the way, in the mouth, if gynecologists do actual culture and sensitivity of the mouth, it is heaped with the bacteria, amoeba, in the mouth. Oh yes, the mouth is an opening. It has lots and lots of different varieties of yeast cells. So even when the man, and this connects Linda with a man who would like to probably even use oral sex.
It's not good?
I didn't say it is not good, it's your word.
Okay.
I'm saying it is okay, but
brush before?
Brush nicely, disinfect with there are very many mouth disinfectants. Because you can transmit fungi, candida from the mouth, you can transmit amoeba from the mouth, and that is where, well, if you allow me, that's the direction I want to take.
Yes, sure.
Now, sort out the different infections that can come from the mouth, that can come from the soil, that can come from probably dirty water, that can come because you dried your underwear in a dusty place, probably because you dried your underwear in the bathroom, in a damp place. So this is the sorting out. Before we sort out, let us know what they are. So don't use saliva. Instead, of course, like we said, they are commercial products. There are some commercial products. They should be, they should have a certain formula. We call it water miscible. We don't want oily miscible. And sometimes you apply these things and you end up with another film, a top film. And we want that place to be clear kabisa. There is another thing. I mentioned about the Bartholin's glands. That duct which will pour the fluid after a good smooch, after probably a good foreplay, that duct must be taken care of. Okay. And that's why I want to mention something. I want to talk about Bartholinitis. That is when there is an infection. It may be external. It may be from dust. It could be from splashings onto the private parts. But it could even be having staphylococcus, a very, very resistant bacteria, resistant to most of the antibiotics that we know. If you get staphylococcus or streptococcus or salmonellosis on those areas, that duct will close down, and sometimes we even have what we call not just Bartholinitis but also abscess.
All right, my favorite doctor is here. I know by now he is your favorite as well. But you know what? The beauty of it is that we pick lessons that are really, really important. Some of the things that you think you know best, you actually do not know. And that's why he started by saying, women will come to you, tell you, oh, I have infection. Just what exactly do they mean? You know, who has diagnosed them to a point where they'd say, now this is an infection. What exactly is this? And he's mentioned a couple of things, you know, medical terms, pathogens, at least I remember.
Pathogens,
and pathogens, at least I have learnt before. And so when we're talking about infections, how do you categorize them? You know, when you're looking at the aspect of pathogens, if I am phrasing it right.
You are coming right on. You are spot on. Why? You find that these days there is over-the-counter medication. It is very dangerous because quite often women and men will have mixed infections, mixed pathogens. Pathogens are germs, if you want. So you find by the time somebody goes to the chemist shop to say, give me something to clean up I'm discharging, what will have happened? I want to start with the word vaginosis. Vaginosis is a situation where there are bacteria mixed with, not always, but mixed with viruses like herpes virus, where she'll get a small or several small vesicles or papules or pimples, they want to call them, around the private part. So there is fungi, there is herpes, which is viral. There could even be human papilloma virus, which causes cancer. There could even be protozoa like amoeba. There could be even salmonella. There could be all these things together. But she has only been able to buy for fungi. So what happens when you are treating only fungi in a mix? It's like a shamba, a garden, which has all types of weeds. And these weeds, each has its own herbicide. And you are buying only one herbicide. So what are you doing? You are leaving the others to proliferate, to grow. So what we are talking about is now sorting out. And I will start with that. It's not always fungal. So why don't you do a culture and sensitivity? And also you people in the lab, there is a problem. You only do one item. Why don't you also do KOH, potassium hydroxide? I know that is not for Linda. A KOH stain will tell you whether there is fungi. Are these fungi in spore form? Are they in hyphae form? Are there different types of... By the way, when you say Candida, you know there are 7 different varieties of Candida. And the commonest one in Kenya is the albicans. So has somebody sorted out whether it is Candida albicans or other types of yeast cells? There are 7 different types of yeast cells. And there are certain factors that will make them grow. So when we go deeper, we want to see whether we have gonorrhea. We want to see whether there is chlamydia. We want to see whether we have Trichomonas vaginalis. We want to see whether we have Gardnerella. We want to see whether... Now, these terms may sound... Of course, because we are not all doctors. We are not all pharmacists. We are not all nurses. But when I say that, you should know that the shamba can have very many different weeds.
Okay.
And it's the duty, the responsibility of a good doctor to sort these things out, by elimination, to say this
are the symptoms of this.
The symptoms of this. I'll give an example because Linda shouted.
Okay.
When you feel, when you smell, when you have a discharge that smells, it is because the discharge has protozoans, like Trichomonas vaginalis, like Gardnerella, like amoeba, ordinary amoebiasis.
Yeah.
So when those have characteristic smells, let me tell you something. After 40 years of practice, if a woman sits with me in a matatu or sits in front of me in the clinic,
you will
and
know?
I will tell you what bacteria.
What bacteria that is?
Oh yes.
Oh yeah?
Because they are specific order. We call it order, whole order. And Trichomonas vaginalis order is completely different from the gonorrhea order.
Okay.
So I'm stressing all this because don't go and tell the pharmacist, give me amoxicillin. What are you treating, my friend?
Bacteria.
Probably your biggest, and I've told you, even these B things, betamethasone, anything adding with a B, betamethasone, it will clear, it will appear like you have been treated. Kumbe, you had herpes. Kumbe, you had human papilloma virus, cancer.
Yeah.
Kumbe, you had probably a gonococcal infection. Kumbe, it could... So, please, let us, practitioners, let us initially identify and sort these things out. And then, once you identify, you know the gun to use. You cannot use the same gun to shoot a lion and the same gun to shoot an elephant. This one must be faster. This one must be sharper. This is the aiming of this fellow. This one must be very powerful to kill the lion, and the other one probably to kill a rabbit would be just a small gun. The one to kill an elephant would be a very powerful vibrating bullet. Similarly, we don't use one and the same product at Nipe, something clotrimazole B. You
know why that happens, Dr. Is because one, even with cold, so you probably go to hospital, and today you're given a certain medication. So in this medication, it works well. Maybe in a day or two, your cold is out. The next time you develop the same, you proceed to the counter and say, you know what, give me this and this and this. So mostly first, I need to understand why is it that it's prone, or some women are prone to that. In most of the times they would get the infections, or so to speak, whatever it is the condition. And so once they get this medication in hospital, the first round, if it happens again or the condition recurs, then they'll proceed.
I want to stop you, Linda. Please allow me to stop you.
I'm just telling you the truth.
No, this one that cures within a day, within a few hours, you know, it is a temporary measure, and it could be more dangerous than the one that will take 3-4 days but cure the problem permanently. It's like somebody comes to you. Now, this one people will understand. Somebody comes with a fever and the joint pains and the upset stomach. Kumbe, this person has malaria, and you crush paracetamol, and you crush ibuprofen, brufen, and you give a tot, like I'm taking a tot of those painkillers. And within 10 minutes,
we're good.
You're good, and you tell, hey, the best doctor is Kibe. But have you treated the malaria? Yeah. Have you dealt with the plasmodium? So the best doctor is Kibe, but those are now the steroids. Those are they are sometimes even baptized at the Jambati Kere. That means at the small one but very powerful one.
Okay.
Now, this small thing that is very powerful will be very dangerous because it has sort of hidden the problem.
Okay.
It has not made me do a proper diagnostic procedure for malaria. And the patient is very happy. Only for next week to have
the problem
10 times more symptomatology than it was from the beginning.
Okay.
Same with the private parts. So we talked about vaginitis. Once they grow there, they go slightly deeper, 6 inches down the line, and they go to the cervix, and we call it cervicitis. Now they start growing at the tip of the mouth, where it's the entrance, the gate to the uterus.
Okay.
So the person gets inflamed. Sometimes we take the woman, we place her on the back, and then we open up and we check. Sometimes we can use like a microscope, a portable microscope if you want, and we check whether there is an inflammation. Ni kama kumepitiwa na ile the worm which produces itch and a lot of inflammation is like manyoya worm which will leave behind a trail of allergy.
Yes.
So we check whether the cervix has any uvimbe or two swellings, or if you want, pimples. That is cervicitis. It's the same thing that was out there. Your man came and he picked from the urine, the drops of urine. Sometimes it could have been brought even by tissue paper, which you left there.
Yeah.
Sometimes anakusanya yote, anapika ndani pamoja na nguvu za kiume na semen zote pamoja. So she gets cervicitis and she starts feeling and itching, and it's inside the itch. She's here with the boss. She's picking a dictation, or she's standing and giving a lecture. Then this itch in the cervix comes, and then she feels. She tries to squeeze the legs together. She tries, and she has to excuse herself to go to the ladies and put a finger and scratch. So that is cervicitis. And that must also be identified with a high vaginal swab. Who knows? It could be human papilloma virus, which will eventually be cancer. So don't go and put ati nipe hiyo mafuta niweke huko, nipe hiyo pessary niweke huko. You could be hiding human papilloma virus. You could be hiding even HIV. You could be hiding herpes zoster, and one day it will come out. You could be hiding what we call genital warts, the Verrutia vulgaris virus and accompanying infections. And one day it will proliferate and come out, and it will be like a cauliflower in your private parts. So why hide? Why do you send somebody to your farm if he is going to not dig but cover with the soil? Leave the weeds still there, but cover it with the soil. From there, it will proceed on to the endometrium, the inside lining, of the womb. And sooner than later, it will start leaking. It will start crying. It will say there is fluid in the endometrium. We shall use the word endometritis.
Okay.
Endometritis. That is probably gonorrhea. That is probably chlamydia. That is probably trichomonas vaginalis. That is probably Gardnerella. That is probably herpes zoster or herpes, whatever it will be. But we must know that now the womb, the inside where the baby lies, is infected and inflamed. And there is even fluid leaking from the walls. And that is very uncomfortable when the girl starts saying lower abdominal pain. Okay? Which is accompanied by a discharge. And this discharge, for this time, it is smelly. Shall we go? If doctor, you are really committed, take time with her. Ask her questions. Does it smell? Is it thick? Because they are also different. You find these ones I'm calling protozoans. They come out as thin discharge, sometimes colored yellow, sometimes colored greenish, sometimes colored grayish. And if it is gonorrhea, it will be colored, it will be purulent and yellowish. So let us take both the physical features, the appearance initially, and let us do a powerful check. What bacteria are we dealing with? 1, 2, 3, or are we dealing with a bacteria with a nest cell, or are we dealing with a virus, and are we dealing, in the bush, there could be even antelopes that are harmless. They are food for the other predators. So what we are talking about is sort these things out now. If you do not, and the lining gets potholes, it is eaten. There will be what you call is like, you see, some girls will get acne, and there are very many what do you call? And when it heals, when the acne, red and the white tops, the pimples, when they finally heal, they can make pock marks. You see? Who tells you there will be no pock marks in there? And now that will bring problems with babies.
You're not able to, you will have difficulties?
There will be difficulties because they will leave a scar. It's just like a road which has potholes. And some places, during the process of healing, it will heal like a bump. And there will be, when we finally do a HSG, a hysterosonography, we shall find filling defects of the dye. Now, from there, it goes to the fallopian tube. Fallopian tube is another big story because it is a good 6 to 9 inches, depending on the size of the woman and the make. It doesn't necessarily mean ati vile huko nje is how you are in there.
Si tunaangalianga na
fallopian tube will not
inside ni tofauti kabisa.
Inside sasa ni kule ndani. And in the fallopian tubes kuna nyasi. To propel the sperm cell, to push it in, and once you get pregnant, to bring back the zygote back to so it is not a smooth place. It's not like glass or smooth like the surface of this table. No. And what happens now? If Gardnerella, if Staphylococcus, if gonorrhea, if what do you call this fungi, if any of them, even if you can get wounds and pock marks on the lips, how about in there? So it will have some places of the fallopian tube will have bumps, some places will have potholes, and now that will cause
difficulties in giving. Inside.
No, this will now be the ectopic pregnancy. The sperm cell is trying to go to reach the egg, and the egg is climbing up to meet the sperm cell, and it gets stuck in the grass that I talked about, the villi, or in the pothole. Have you ever imagined a big pothole on a road where a car has to now go very slowly and gently in and then out? And sometimes they get stuck and you have to rev it to get out of the pothole. So suppose a sperm cell gets stuck in a pothole created by a sexually transmitted infection. That is an ectopic pregnancy. If this pothole is infectious na imefanya kijividoda, then it blocks altogether. So you find sometimes when we put the dye in HSG, in hysterosonography, you find the dye reaches a stage and it cannot proceed anymore because there is a blockade. It blocked fallopian tubes. So blocked fallopian tubes are not things from God. They are not. No, it is an infection. It is gonorrhea. It is chlamydia. it is probably Trichomonas vaginaris, it could be Gardnerella, it could be Staphylococcus, it could be salmonellosis, it could be any of the things that we've been talking about.
So go to hospital.
Go to
proper
hospital.
Diagnosis.
Ali, and you, whom we are talking to, my colleagues. I'm not a teacher to my colleagues in medical fraternity, but I like reminding them when you are giving this tablet, clomiphene citrate, ili mtu apate miba. Have you checked whether the fallopian tubes are blocked?
Problems.
Have you checked whether the ovaries are proper? Have you checked whether there is endometriosis or adenomyosis, or now I'm addressing my colleagues?
Yes.
That please be sure when you are giving clomiphene citrate and telling ati hii ni ya kukuletea joto ya kuzaa. Namna gani? Joto sasa umetoa wapi? Ati I'm ripening your eggs.
Okay.
Suppose you ripen, and it's good effort to ripen the eggs, but to go where and the fallopian tubes are blocked. When you people in the pharmacy, CAP 244, subsection 17, 3A, and it says scheduled diseases.
Okay.
Do not advertise the following. 1, infertility. 2, a man's inability to perform. Don't advertise the drugs or diseases of the reproductive system. And then you find certain what do you call them, media houses like this one of yours is allowing, against chapter 244 Kenya law, somebody to say this is the best drug for libido. Come on, please, media. This is the best drug for infertility. What are you doing? It is not. You are not professional. Professionals do not tell lies. So you first have to do proper diagnosis. You must know that there are no blocked fallopian tubes. You must know that probably it is her eggs. Oogenesis is the process of making the egg ready for to be fertilized.
Okay.
So what are you doing? What are you treating? If you have not done the ones that we said, probably minimum of 12, maximum of 17 tests before you declare a lady that this is infertile.
Right.
In fact, I don't use the language infertile, because if she is infertile, what are you doing with her? You should have given her a prescription for IVF long time ago. She is subfertile. You are trying to provoke fertility. So you cannot provoke fertility without doing proper diagnostic procedures. Okay. And they include lab work, they include radiology, they include physical and the symptomatology that the lady is telling you. Don't brush her off. Don't spend 5 minutes with a client. Spend up to half an hour minimum, upwards to 2 or 3 hours, so that you may know what you are doing. You're talking about a baby or babies. This girl has been married for 4 years. She has never gotten a baby, and you are just simply giving her clomiphene citrate. Who told you it is the best? You've not even checked what is in this discharge. You've not even checked the lower abdominal pain. What is causing it? You've not checked amongst the same pathogens, germs for our language, amongst the same germs, some cause very sweet and nice feeling of itchiness. We call it pruritus in our language. Some don't. It's just like I said about a certain hairy worm, which causes a rash like an allergy. Not all worms cause that rash. Yeah. Some worms will climb on you and go down. Some will just touch you kidogo. Even plants, like stinging needle.
Yeah.
It will cause very nice and sometimes very sharp and itchy skin reaction. Not all plants will cause that. Sort this out and say this is a stinging needle. This is nyanya tomatoes. This is waru potatoes. This, because all the signs and symptoms will guide you slowly towards it. Don't give general things. Back to the basics. Hygiene is key.
Okay.
Hygiene of the other pants. Back to the basics. Diet
is key.
Back to basics. Watch out, listen carefully. And there is a new technique which sometimes I disagree with, sometimes I have no way out of it. I'm old school. Doctors are not taking notes. You see, sometimes
I agree.
You are talking to them and they are even searching for
other things.
the disease by Google. Oh God, no, you cannot treat. Even patients are not happy. You are talking to her and you are Googling what she's telling you.
Yeah.
I mean, she will not even have confidence in you.
No, not at all.
So let us get to know precisely what the best language is. Sort out the different problems that start. What causes bad smell?
All right.
What causes itch?
What
type
smell is
of
this?
itch? Which organ in her body is let us even go to the ovary, the last stage. This is the last stage. This is the last shot. Probably this girl, and you should be told that one, probably she used P2. Probably she used Norplants or other family planning methods.
Yeah.
Probably she ended up with ovarian cysts. Ovarian cysts are not...
As we wind up, yes.
Ovarian cysts are small, it's like blisters, small bags with fluid or semi-solid material, which are not going to be treated with antibiotics. You heap antibiotic upon another antibiotic, and you don't know what type of ovarian is it. Is it polycystic ovarian syndrome? Is it a single cyst? Is it a complicated cyst? And how can we help her? Probably it's a simple laparoscopic drainage of the cyst.
Right.
And you are giving clomiphene citrate. No. Do the proper diagnosis, my colleagues. Thank you very much.
Thank you so much, Dr. Your number as we close.
Yes, if anybody wanted to reach me, I'm on 0722 534444. 0722 534444. I like to mention that when you write SMSs, I'm happier than when you try to telephone me and I receive 2,000 telephone calls at the same time and it blocks.
That's true.
And if you keep SMSing me, I may not be able to, it's even illegal, it's unprofessional, to try and do a gynecological test or advice or treatment or writing medicine through the phone.
Through the phone,
So mine could be even to direct you. You are in Kakamega, this is your problem, yes, see so and so. You are in Theka, yes, see me. I occasionally go to Theka every evening. Thank you very much.
Thank you so much, Dr. It's always an honor to have you. Key things that you say: diet, hygiene, please properly diagnose.
And knowing the cycle. Yes. When do you do that action specifically for a baby, and when do you do it for pleasure?
We probably need to discuss that next time.
I think it's worth it.
It is worth it. All right, see you next time. That is on Monday, as we certainly hope to have Dr. on board. Thank you so much. I get to see you again tomorrow. My name is Linda Alela. We close Morning Cafe at that point, as again, we look forward to tomorrow. Have a lovely, lovely week ahead. Thank you, Doctor.
Thank you very much.
All right.
Yes.